Armando Hasuringan Biology and Medicine videos. Please make sure to subscribe. Join the forum group for the latest videos. Please visit Facebook Armando Hasuringan, and here you can also like. Please ask questions, answer some questions, and post some interesting things, including artworks. It would be greatly appreciated. And you can also change the quality settings to the highest one for better graphics. In this video, we're going to look at an introduction to the muscular system. Our muscular system obviously is our muscles, and muscles are important in keeping the homeostatic conditions of our body. It's particularly important for us when we breathe, and also for movement, such as lifting weights, for example, or lifting anything. It's also important because it gives us heat and provides us with balance and also stabilizing our joints. Now, there are three types of muscles. There is the skeletal muscle, cardiac muscle, and smooth muscle. We'll begin with looking at skeletal muscle just briefly. Now, skeletal muscle is essentially the muscle which we require when we move and when we lift things up. Skeletal muscle differs to the other type of muscles because they usually connect to the ends of bones, such as the thigh bone, for example, and they're voluntary and also striated. They're voluntary because when we move our arms, we are voluntarily moving them. And so, for example, skeletal muscles are the muscles such as our bicep muscles, our pectoralis major, and our quadriceps, for example. And so if we zoom into this particular skeletal muscle, a skeletal muscle cell is cylindrical shape, and as I mentioned, they're also striated. But another important feature of a skeletal muscle is that it is multinucleated, which means that it consists of multiple nucleuses. And this is what differs skeletal muscle to, for example, cardiac muscle, and the other one is smooth muscle. So the second type of muscle I would like to look at is the cardiac muscle. And the cardiac muscle essentially implies the heart, because cardiac implies heart. And so we're looking at the heart muscles, such as this area here. Cardiac muscles are amazing because they keep contracting until the day we die to pump blood around our body. Cardiac muscles are involuntary, meaning that we have no conscious over it. And so that is why we have no conscious over our beating heart. And cardiac muscles are also actually striated, like skeletal muscles. So if we zoom into the cardiac muscles in this heart, for example, we can see a few cardiac muscle cells here. Cardiac muscle cells are either uninucleated or binucleated in that they have one or two nucleuses per cell. And each muscle cell are separated by what's called intercalated discs, which help combine each cardiac muscle cell, as well as assisting in transmitting nerve impulses throughout the heart during contraction. The last type of muscle we're going to look at is the smooth muscles. And smooth muscles are found in the stomach and in the intestines, essentially the gastrointestinal tract, or GIT. And they usually wrap around each of these organs to assist in the movement of food down the gastrointestinal tract, from our mouth to our anus, essentially. And this movement of food down this gastrointestinal tract is known as peristalsis, and this is assisted by the smooth muscle cells. And so as expected, smooth muscle cells are involuntary in that we have no conscious control over it. And what differs smooth muscle cells to cardiac and skeletal muscle is that they are unstriated. They contain no striations whatsoever. And so if we zoom into this part of the stomach, duodenum, part of the small intestines, we can look at the smooth muscles, and you can see that they're unstriated. They contain no striations, and each cell is also uninucleated in that it contains only one nucleus. And so, for example, this group of smooth muscle cells, they are in a relaxed position, and when they contract, what essentially happens is that they squeeze together, and when they squeeze together, this is what allows the movement of food down our gastrointestinal tract. And so that was a brief overview about three types of muscles and the muscular system. Please click on the skeletal muscle link or the smooth muscle link to learn more about these muscles. The cardiac muscle link will not be available because we will learn about the cardiac muscle in the cardiovascular system, because the cardiac muscle has an important role in pumping blood all throughout our body. Hope you enjoyed this video. Please like, comment, and subscribe. Thank you all.
Erectile dysfunction is the inability of a man to confidently initiate and maintain an erection sufficient for vaginal penetration to the mutual satisfaction of him and his lady. The common causes of erectile dysfunction are vascular disease, prostate cancer treatments and Peyronie's disease. The treatment options are to modify lifestyle and vascular risk factors, to use PDE5 inhibitors, these are the pills such as Viagra and Cialis, to use penile injection therapy, or best of all, penile prosthetic surgery. Now, whilst there are a number of options for erectile dysfunction, many men like to get on with it. They know that they have had a long-standing problem, they've tried conservative measures, they want a penile prosthesis because they want sexual spontaneity and they want to eliminate performance anxiety. They want to be confident that they can make love every time without failure. When I'm talking to men about erectile dysfunction, I really encourage them to bring their partners with them. You're treating a partnership, a relationship, not just a man and his erection. So the partner's presence is very important. Now, a penile prosthesis is a terrific way of restoring sexual spontaneity and eliminating performance anxiety. What it is a very clever prosthetic device that is implanted inside the patient. It has a reservoir of fluid, it has a little activation and deactivation pump that is just under the skin of the scrotum, and it has two erectile cylinders that are placed deeply within the penis. When the man wants to make love to his partner, he feels for the little pump in the scrotum. Within 30 seconds he has a well-maintained erection. When they've finished making love, he pushes a little button and the penis once again becomes flaccid. In talking to my patients, they are very relieved after penile prosthetic surgery. They feel like a man again. They feel fully functional. They are a very happy group of patients. This is a device that works, it works well, it's good for the man's self-esteem, and it's great for the relationship. Penile prosthetic surgery is very reliable surgery. The device itself is long-lived. It should provide at least 15 years of quality sexual interaction. There's a 1% risk of infection, and the malfunction rate these days is very low. The benefit of penile prosthetic surgery is that it fixes the problem immediately. 6 weeks after the surgery, a man and his wife can have sex together comfortably and spontaneously, without performance anxiety. Many men leave the decision to have a penile prosthesis far too long. If a man has poor erections prior to surgery for prostate cancer, those erections will not improve after surgery. Therefore, 3 months after radical prostatectomy, once the man is well recovered, he should consider penile prosthetic surgery. That then restores his sexual function and completes his rehabilitation.
Skeletal muscle also called striated muscle because of its striped appearance under the microscope, is used to move the skeleton. Skeletal muscles are under the direct control of the nervous system and can produce contractions ranging from quick twitches to powerful sustained tension. Individual muscle cells, called muscle fibers, are among the largest cells in the human body. Ranging from 10 to 100 micrometers in diameter, each muscle fiber runs the entire length of the muscle, which may be as much as 35 centimeters or about 14 inches in a human thigh. Each muscle fiber, in turn, contains many individual contractile subunits, myofibrils, extending from one end of the fiber to the other. Each cylindrical myofibril is surrounded by sarcoplasmic reticulum, a complex of membranes forming a network of interconnected hollow tubes. The sarcoplasmic reticulum contains a fluid rich in calcium ions. Deep indentations of the muscle cell membrane, called transverse or T-tubules, extend down into the muscle fiber, passing very close to portions of the sarcoplasmic reticulum. This arrangement of T-tubules and sarcoplasmic reticulum is crucial, as we will see, to controlling muscle contraction. Myofibrils contain subunits called sarcomeres made up of precise arrangements of actin and myosin filaments. Sarcomeres are attached end-to-end throughout the length of the myofibril, and their junction points are called Z-lines. Attached to the Z-lines are strands of actin and two accessory proteins that form the thin filaments. Suspended between the thin filaments are thick filaments, composed of the protein myosin. The alternating thick and thin filaments give myofibrils their striped appearance. Small arms, called cross bridges, extend from the strands of myosin and contact the thin filaments. The actin protein of the thin filament is formed from a double chain of subunits resembling a twisted double strand of pearls. Each subunit has a binding site for a myosin cross bridge. In a relaxed muscle, however, these sites are covered by two accessory proteins, which prevent the myosin cross bridges from attaching to the thin filaments. But when a muscle contracts, the accessory proteins on the thin filaments are moved aside, so myosin cross bridges can attach to the binding sites on the actin subunits of the thin filaments.
I think particularly with myasthenia gravis, as I'm seeing more and more patients and getting more and more experience, I think that the earlier the diagnosis and treatment with myasthenia gravis is very key to effective treatment and a reversal of a lot of symptoms. For a disease such as ALS or with some of the muscular dystrophies, where there's not necessarily a cure, early intervention is very important, I think, for the patient and their families to understand what limitations may develop and gives better options to circumvent some of the difficulties or disabilities that they have.
I treat a lot of patients with myasthenia gravis, which as opposed to ALS is actually a disease that we actually have fairly effective treatments for, and we tend to get difficult patients with myasthenia gravis, and There again, we're involved in clinical research in myasthenia gravis, the goal there, this is a much longer term disease because patients live with myasthenia gravis, and in many cases, after proper treatment, patients can live a near normal life.
The way I explain it to patients, it is a condition in which their immune system is revved up and attacking their muscles and seeing a particular receptor on the muscle as a foreign object. So we want the immune system to attack foreign objects. Like when you have a pneumonia, we want the immune system to get rid of the pneumonia, that bacteria. But for myasthenia gravis, the immune system is attacking the own self, and the muscles bear the brunt, and so patients get weak. Myasthenia gravis, what we often do is to treat patients to suppress the immune system to a more normal level, and we use various medications to do that, either oral medications, or when things are very resistant, even IV medications, to try and get the immune system back in balance. And then also we use medications to try to treat symptoms. We have some medications to temporarily make patients a bit stronger, because it acts directly on the muscles to allow the nerves and the muscles to communicate more effectively, so that it makes the muscle stronger.